Health Hats, the podcast.
As it relates to patients, their care partners, and clinicians, where do you see data playing a role in improving health access?
I want to do some level setting and to say, thinking about or hear about data, but where data leads to information, leads to knowledge, leads to understanding, and then, Lord help us, wisdom. Next, to put yourself in the mindset of being a patient yourself, or a partner, or a parent, or a child, or a neighbor, or a relative, or a navigator. And so let's call that umbrella caregivers. When I query people who caregive as part of every week, locally or remotely, and I talk to them about the tools that they use or need, here's what they say. They use, first and foremost, lists and spreadsheets. They use calendars. They use phone and the internet. They use portals. Rarely do they use apps. An exceedingly small proportion of people use apps, and they rarely use them for more than a month. Okay. So I think why people use tools is they use it to project manage. Now, people call that life. But what are they managing? They're managing medications. They're managing the team members, whether those are medical people or support people. They manage tasks, appointments, records, learning, sharing, and coordinating. So after assisting with the activities of daily living, most time is spent managing time, managing people, records, behavior, and tasks in no particular order. They would love to make any of the administrative tasks easier, but once they find a practice that works, whether or not it looks like it works to you or me, they're reluctant to change those methods unless it's easy to learn and fits in their current pattern. Don't mess with what works. Having said that, they describe project management, my word, disruption occurring every week, if not every day. So I propose that you data geek clinicians, academics, policy people that are sitting here conjure up a use case, anything you're working on, that as a use case that you have lived or you know somebody who's living. And if you can't, for sure someone intimately who can, and self-reflect and learn more about that scenario, and then invite people with lived experience as a patient or caregiver into your team as a full-time member.
I host, write, and produce Health Hats, the podcast, with assistance from Kayla Nelson and Leon and Oscar Van Leeuwen. Music from Joey Van Leeuwen. I play Barry Sachs on some episodes alone or with the Lechuga Fresca Latin Band. I'm grateful to you who have the critical roles as listeners, readers, and watchers. Subscribe and contribute. If you like it, share it. See you around the block.